what we discussed this morning is also a lot about triplet treatment. We have seen that undetectable MRD rates are higher, even when we look very deep for MRD. The data have been shown by Mürus now. On the other hand, we know that the triplet has more side effects than a doublet regimen. However, there was some agreement that in particular very high-risk CLL or higher-risk CLL may benefit from triplet regimen, and I think we will get more data on that during the next few years, also with longer follow-up of phase 3 studies as the Amplify study, for example. The other thing which was also discussed, showing now what impact undetectable MRD has, is when are we ready to test that in routine. I personally think we are not yet ready, that this shouldn't be recommended by guidelines, but certainly individually in some patients who want to know if, with respect to the treatment-free interval duration, how good is my chance that I can be off treatment for a couple of years, it makes sense to test for MRD, because in the end it's a similar or even better information than doing some imaging as a CT scan, for example, showing that there are no lymph nodes. So it's similar, showing that there was no detectable MRD, may have for the patient valuable information with respect to the time to the next treatment. However, we are not yet at the status where we should test for MRD by routine for example, prolongation of the treatment.